Welcome to the Private Practice Survival Guide podcast with your host, Brandon Seigel. I'm a published author, speaker, entrepreneur, and private practice strategist dedicated to transforming the way that healthcare functions. This podcast is all about empowering you to create the change you want to see. Let's dive in. Welcome back to the Private Practice Survival Guide podcast. I'm your host, Brandon Seigel. In this quick tip solo episode, we're talking about building your practice's security incident response plan. So cybersecurity is not just a technology problem, it's a leadership responsibility. I need healthcare practices to understand they must take responsibility. They are the most targeted organizations in the country. And together today, we're going to talk about some quick little things that you can do to tighten up your incident response plan. So, cyber risks that are facing you, honestly, healthcare, we handle PHI every day. Patient health information is everywhere we touch. And that makes us a target, not because of our size, but because of our data. So many small practices assume they're too small to be noticed, but the reality is the smaller practices, they're easier to crack. So we need to make sure that we are protecting ourselves. We need to look for phishing. That's deceptive emails designed to steal credentials or deploy malware. The number one vector for healthcare breaches is phishing. Phishing, not this. So the next is ransomware. That's where something encrypts your systems and demands payment for restoration. It can shut down operations for days. I've talked about this in past episodes. I have several practices that have been locked out of their system and had to pay over six figures to get it back. Weak passwords. We are seeing weak passwords everywhere. EMR, email, billing, all of that. We must strengthen our passwords. Lost devices is another thing. Unencrypted laptops, phones containing PHI, that's an automatic breach, and we have to know. Insider error. We have people coming into our organization. We don't even recognize what they can do, how they take stuff off a printer, what they have access to, etc. And then HIPAA exposure, obviously, OCR investigations, fines, mandatory corrective and action plans, all those different things. So there's a lot coming today. And the first thing we need to do is we need to build our incident response team. Who is going to be on this team? Usually it's an owner, decision authority, etc. We have a communication contact. That's the person that will communicate when something's been breached. That might be the owner, that might be the CEO, that might be the office manager, might be the clinical director, whoever. Then we need an IT partner, someone that's in charge of locking things down. A lot of the time, we're going to go off site for this. We're going to get someone that's all they do. They become our IT partner. Then we've got a compliance lead, someone that's overseeing and analyzing that. That could be us, that could be someone else, but that's someone looking for compliance violations. And then internal coordination is usually being done by our COO or operations leader. This is our incident response team. And so the first 60 minutes of a security incident are vital. That first hour after a breach is detected is the most critical time for your organization. How your team responds in those 60 minutes will determine the scope of damage, the extent of your legal exposure, the ability to recover quickly, and every practice needs a documented first response protocol. So, in order to have that first response protocol, we also have to have staff that know it. So we need to understand and isolate affected systems. That means we have to disconnect compromised devices from your network immediately. Do not turn them off. Preserve the digital evidence. We need to change all credentials, reset passwords on email, EMR, billing systems, any cloud platforms, especially if credentials may be compromised. We need to notify our IT partner, engage your IT partner immediately. They lead technical, containment, and forensic investigation. We need to preserve evidence, document everything you observe, timestamps, screenshots, error messages, communications. Do not delete anything. Then we need to assess the scope and notify. That means determine what data was accessed. HIPAA requires breach notifications within 60 days. Begin the clock now. Everything has to be disclosed in that way. The next thing we need is we need to make sure we have quarterly staff security training. This is where technology defense alone is not enough. There's too much human error. So how are we training people? Are we doing the right training? Do we have certificate training? Your staff are your most important line of defense. Regular and practical training will save so much vulnerability in your organization. So you're going to train your team quarterly on phishing recognition, password hygiene, secure file handling, reporting protocols. And I always say, don't trust unless it's earned your trust. And recently I had signed up for something and the emails that I got back did not look right. So I just deleted them. I was like, forget it. I don't want to deal with it. Sometimes we got to disconnect from terminals that don't look safe. We need to really trust is earned, not given. So when we're training, it's important that we keep these sessions short, 15 to 20 minutes max. Use real examples, use current phishing scenarios, document completion for compliance evidence, conduct simulated phishing tests annually, and then reward staff who report suspicious activity. Have a game out of it. And so documented quarterly training is a powerful defense in the event of an OCR investigation or a HIPAA breach audit. And so these are all things that are going to help prepare you to be proactive. We want to implement a HIPAA-compliant data backup system. So protecting patient data requires a robust and reliable backup strategy. Data loss is not just a technical issue. It's a violation, as I've said. So we want to adopt the 3-2-1 rule. Maintain 3 copies of data, 2 different media types, 1 copy offsite for a disaster. We want to utilize HIPAA-compliant cloud storage. We want to test our backups routinely. We want to avoid data loss disasters. Losing patient data means HIPAA fines, reputational damage, and a severe business continuity crisis. The next thing we need to do is we need to conduct an annual security risk assessment. We need to look at physical safeguards, technical safeguards, administrative safeguards. Identifying the vulnerabilities is your only first step. You must then prioritize these risks based on the likelihood that there is a potential impact and implement a remediation plan. Document your entire assessment, including risks, mitigation, and ongoing monitoring. This is all going to help prevent that gross negligence risk. So something that's important for you to know is that healthcare is the most targeted industry for cyber targets, making it a prime focus for malicious actors. For the last 13 consecutive years, healthcare has been the #1 target. The average breach cost is $10.9 million. Again, the average cost of a healthcare data breach continues to rise, and that impacts financial stability. Now, recognize these small practices are not $10.9 million, but just so you understand the severity, it has been documented that 95% of it is a human error factor. The vast majority of data breaches involve human error, emphasizing the need for robust training. And then 287 days to detect. That is the number. Small practices face significant delays in detecting breaches, prolonging exposure, and potential damage. So in healthcare, a data breach isn't just an IT problem. It's a patient trust problem. And once that trust is broken, no firewall can rebuild it. If someone got all my x-rays from a hospital, I would not be happy with that. If all of a sudden I got on some list for medication because they saw what diagnoses I have, I would not be happy with them. You know, this is a trust area. And so for private practice owners, this underscores a profound responsibility beyond mere compliance. Safeguarding patient data means protecting the most sensitive aspects of an individual's life. Preserving that sacred trust that they've given you is crucial to the clinician-physician-patient relationship, if that makes sense. And so here are some, again, things that I want you to keep in mind. I'm seeing a lot of practices with weak or shared passwords, no multi-factor authentication, staff clicking phishing emails, unsecured personal devices, no VPN, missing business associate agreements with the software and vendors they use. These are all things that are really important. And so things I recommend: have a password management tool like a LastPass, a 1Password, etc. Utilize HIPAA-compliant communication like Doxy.me, Spruce Health, Signal. Security training like KnowBe4. Backup solutions like Backblaze and Acronis, etc. And then incident response resources, OCR HIPAA resources, cyber liability insurance, HHS breach notification portal. All these things can help you in the event of a breach. And so we need to have security in our onboarding. We need to integrate cybersecurity best practices into the very first steps of an employee journey. We need to do regular phishing simulations so we can find out who's clicking on them. We have to have a no blame reporting culture, which means that we're encouraging immediate response and reporting. Reward secure behavior and designate your security champion. All things that are really important. And so if there is a HIPAA breach, you must notify affected individuals within 60 days. Media notification: if a breach affects 500 or more residents of a state or jurisdiction, you must notify prominent media outlets serving the state or jurisdiction. You must document your response. So through documentation of your breach response, all steps are taken, notification is sent, etc. And so these are all part of adhering to these protocols, etc. And so for this week, this is what I want you to do. I want you to enable multi-factor authentication. I want you to make sure that your EHR, EMR, email accounts, and all of that are relying on that. I want you to change all of your shared or weak passwords. I want you to identify that all vendors have BAAs on account. And in the next 30 days, I want you to conduct your comprehensive risk assessment of your practices, digital assets, and data flows. Develop the robust security incident response plan. Implement your mandatory, regular cybersecurity and HIPAA compliance training for all staff members. I want you to establish secure, encrypted data backups and recovery solutions. And I want you to formally review and update all of your BAAs to ensure they meet current regulatory standards. So I appreciate you being part of this episode. You need to know the cyber risks facing your practice. Build your incident response team. Master the first 60 minutes of a security incident breach. Conduct your quarterly staff training. Implement HIPAA-compliant data backup systems, and conduct your annual risk assessment. Thank you for tuning into this episode. Don't forget to like us, subscribe, share us with those you know and who could benefit from this, because together we can thrive, not just survive. Thank you for tuning in to the Private Practice Survival Guide podcast. I'm incredibly grateful to each and every one of you. Exciting news. We're now available everywhere, from Spotify to Apple Podcasts to YouTube or anywhere you like to listen to your podcasts. So watch, listen, and reach out. If you love this episode, please drop a 5-star review. It truly means the world to me. Are you looking for more ways to elevate your practice? If so, now is your chance. Reach out, go to my website, or email me at brandon@wellnessworksmp.com. And remember, it's not just about surviving, it's about thriving.